As an example of a splenic artery aneurysm, you can see it's a saccular aneurysm looked at in multiplanar reconstruction. It was patient was having some left upper quadrant pain. It only measured 2.5 centimeters. We opted to go ahead and treat it. And the initial plan was to actually treat it with a Viabon stent graft. That's always a challenge when it's extraordinarily tortuous. First thing we've done is cross this with a quick cross catheter, and once we've done that, we can exchange it out for a Rosen wire. Over the Rosen wire, you can see initially we're going to attempt to bring the Viabon, but it really is just too tortuous. Even though it's flat and the Viabon's fairly flexible, it will not actually hold its position. And so we gave up on that idea. Then you got to reposition the wire distally. That involves putting the quick cross back in, reposition usually with a glide wire, and then exchanging out for the Rosen wire again. At that point, the backup plan, of course, was to go ahead and to embolize this. We did do on-table cone beam CT, and it showed really that there's one main inlet and outlet branch. You'll see how we actually use fusion to mark those. This is us kind of repositioning this. There may be a little extravasation there. And so now we're using the quick cross to reposition the catheter more distally into the splenic artery. And the game plan really was to try and put in some framing coils and then to pack those coils. It's pretty easy to get the wire really back out in position. It just kind of shows you really the degree of tortuosity, and that's one of the first things you really should be looking at, is just how tortuous is that splenic artery, and is that going to be associated with challenges in tracking devices out there. Coils almost always track, but not necessarily a Viabon with stent graft. So plan A didn't work, even though it's really one of the more proximal bends we had to navigate. It still kind of wouldn't go out there far enough. And again, what we're doing here is working to make sure that we really get far enough out. If you go back and look at the multiplanar reconstruction, you can see that there's two main branches, but when you look at it, there's one smaller branch that's also coming out of it. So again, that's just kind of showing us reposition that wire while looking at trying to choose on the right screen what is the optimal angle to be able to show what these branches actually are. So that's kind of a repeat really of what we've really already done, showing you really how we can rotate the 3D reconstruction so we can get the optimal angle for positioning the wire, and then we can also fuse. And you'll see how we use markers that we fuse on and off, that we can toggle on and off to show us where the branches actually are. So now kind of going back to where we're at with the Rosen wire positioned distally. Optimizing the imaging here by bringing in the filters. And kind of we're always going backwards and forwards looking at the CT scan or cone beam CT scan. Now you can actually see how we've laid out. There's a smaller branch. We've marked that out on the CT scan as red. The inflow is green, and we'll show basically what the outflow actually is also. So if it's a 2.5 centimeter aneurysm, we're probably going to put in 15 millimeter framing coils. And so these are being delivered through a quick cross catheter. And now you can see we're marking green the inflow and the outflow. That coil is in place. I'm going to use much smaller coils to actually pack this. That's the same coil that we're showing you again. And then you typically size down the coils, maybe 7 or 8 millimeter coils we're going to pack this with, and we'll just kind of keep putting those in until we get fairly dense packing. I think one of the common mistakes is not to pack these hard enough and tightly enough. Now it's always the last coil you put in that kind of gets you in trouble. So you can see the coil is looping. You obviously worry about that. Not much you can do about it at this particular point in time. and one more coil to actually pack in there, actually help pack down that loop just a little bit more. So that's really nicely packed. And then we'll get completion angiogram. Once we put in the last of the coils. So there ain't much room to put many more coils in there. That's pretty dense. And you can see the angiogram. Actually, all the branches are actually flowing. We opted to stop at that. Patient got follow-up, and actually the branches were still flowing on the 1 month CT scan. Thank you.